the resume. We know that the resume is so important. So how should I tailor my resume for these roles?
Yes, and this is something that is super crucial. So I really wanted to talk about it today. So when you're working on your resume, you have to understand that a human is not going to read your resume first. A computer is going to read it, an applicant tracking system. So you have to trigger the applicant tracking system. A problem that I see often across all levels, whether entry level, master's level, experience level, people are making general resumes, which isn't necessarily bad, but it's not good either. And it's not necessarily going to get you what you want. So you really need to tailor your resume and use words and phrases. And I'm saying it like this because I want you to understand. Please do. Okay. Words and phrases from the job description and put them into your resume. So an example I like to give people all the time is
Hey everyone, and welcome to another episode of the Health IT Playground. And for those that have never been here before, this is my time to have you guys learn from experts about different areas of health informatics, health IT, whatever you want to call it. But today I'm excited because we're going to touch on an area that is very popular, just the talk of the town sometimes, and that's about government tech, right? As you guys know, health IT has positions that are within the government space. And so we have here an expert that is going to be speaking to us today about this. She's actually a health informatics analyst for the government sector. So I found her on TikTok. We're going to talk about it more for you TikTokers out there that are looking for information. She's going to be your girl. But let me stop talking. I'm rambling, and I'm just gonna go ahead and introduce Briona Bragg to you guys and have her introduce herself, and then we're gonna jump right into this interview because there's a lot of things to talk about. So thank you, Briona, for your time, and I'll let you just introduce yourself.
yes, what a lovely intro. Thank you so much. And thank you for having me on, Juliet. Yeah, so like you said, I'm a health informatics analyst. I've been in this field for nearly 2 years now. It's been great so far. It's truly just been a way to really just level up my life and still be able to contribute to the health field, which I really love, but also be able to combine that with a career in the tech sector and be able to make that kind of money that I need to survive in the DMV. I've been in this field for 2 years. My background is in community health. So I got my bachelor's from Towson University. So shout out to any Towson alum that may watch this. That was just a journey in and of itself, trying to figure out what kind of degree that I will get. But I ended up with my public health degree. It's officially the health education degree, but I still consider it like a public health degree. And yeah, I went on to be a care coordinator and I was working with pregnant people and newborns and children, which I love so much, just being able to provide that health education and just having a strong background with the community and being able to just have that grassroots level of building up on that public health field. So I ended up switching over to the health tech side because of TikTok and just being like influenced by all the people in the tech field. I'm like, wow, you guys are really killing it out here. And I just got curious as to how I can combine that public health background that I have with the tech field. And that's how I got to where I am here today. And I'm excited to just dig more into that process and let you all know more about the field.
Okay, awesome. And you've already answered my first question, so thank you. How did you learn about health IT? And so your answer would be from TikTok.
Yeah. So TikTok, this was during the pandemic. I had way too much time on my hands, just on TikTok, way too much. And I really started to get interested in these girls that are soft light and they're in tech and they live in these high rises. And I'm like, why can't I do that? Why can't there has to be something where I can combine health and tech? And I wasn't familiar with health informatics at that point. So I kept seeing this advertisement to become a data analyst. So one day I finally just clicked the ad on TikTok and I was just navigating through it. And somehow I ended up on my current employer's career site. So from there, I ended up just searching something like health tech, and I just went down their line of jobs. And this is a company that's a defense company. So I really wasn't sure what I was doing on their website, but I was just like, let me see what happens. So I found the role that I'm in, which officially the job title is a program analyst, but internally I'm referred to as a health informatics analyst. Yeah, that's how I found it. And I said, okay, I can do this. This doesn't sound too hard. Let me just try it out and see what happens. And it ended up working out.
Perfect. And I know that you are also currently in school studying to get your master's in public health. Is there any connection, and I'm sure there is, any connection between what you're learning currently in school and your career currently as an analyst?
Yes, definitely. It's so exciting to finally put the pieces together between the public health and the health IT sector. I'm getting my master's of public health with a concentration in health informatics. And so it's definitely very relevant. And now that I'm just about finished with my first year, so I'm finally finishing up my prereqs and I'm finally taking my health informatics courses. And one course that stood out to me so far, I'm taking a population and community health analytics class. So I'm really learning how to use data to make health decisions and to influence systems and convince policymakers and health departments to make these suggestions that have come to found from my data insights. So my project this term, I'm working on a using data to find a way to make a solution to asthma in Baltimore. And so my solution is to, excuse me, solution to pediatric asthma in Baltimore. So based on some of the findings that I found with using the data, is that moving children out of areas where there's a high cluster of children with asthma into better neighborhoods in Baltimore. I find that's a very good solution. So I'm just trying to find a way to put all the pieces together to convince the housing department to continue this program. So yeah, it's very interesting so far. And there are other classes that I'll be taking, like predictive analytics, data management, that will really tie into the health informatics career.
Perfect. And I'm just curious because I've had people that were data analysts on this show and we're doing social media analytics. Are you using the Tableaus and the SQLs and the Rs? Are those tools that you're using currently in that program?
Yes, definitely. I use Tableau, I use R, I use Excel. I would say those are the main things that I've used so far. And actually, this week I'm going to start using SAS in one of my classes. In my biostatistics class, I learned about stats, SAS, and we took images of SAS and did math from that. But now we're actually going to go into SAS. And that's another thing I love about the program that I am. They actually offer all of these softwares for free. So I can use R, I can use Python, I can use SQL, I can use Stata, I can use all of that for free, which is technically not free because I'm paying them like $90,000.
Sure.
But, but yeah, so those are very relevant skills. And I try to emphasize that on my TikTok so much. If you want to make money in like health analytics or health informatics, that's really the way to go to learn one of those skills.
I love that. I love that. And I'm gonna redirect us right on back to your role. So as you guys can hear, having the knowledge and investing in yourself to learn skills will definitely help you to be successful in the type of role that you're in right now. So what does your day to day look like?
Yeah. So my day to day, let's just break it down from the morning to
Okay.
when I'm clocking out. So when I come in, typically what I do, I have a bunch of emails. We have a lot of automatic emails because there's just like a lot of processes that go beyond this behind the scenes. So I'm sorting through my email, just trying to piece together my day. And then after that, I continue on to do some reports. So each team member sort of has their own kind of specific duties that they do to just keep processes moving. So I go into some different reports, checking on the status of certain things, making sure things aren't expiring, in which I know doesn't make sense in this context, but yeah, just a lot of reports. Then I go on to have meetings. We have lots of meetings, and which is good because it's really a collaborative deal. It's an individual job, but we come together as a team to make sure like all the processes are moving and there's any issues with the data, or if there's new data, we talk about the new releases of data. So yeah, the meetings can be about a variety of topics. And yeah, then I go on to the meat of my duties, which is really just like data management. In this role that I have, I'm not really a traditional data analyst in the sense of using data and manipulating data. I'm more so managing the data and allowing people who do use the data to better use it. And you could say I'm a subject matter expert, or a SME in like Medicare data and Medicaid data. I'm working on building my knowledge. It's coming with time, but being that I've been there for nearly 2 years. I think I'm growing towards that SME level. So just being an expert in understanding Medicare data is a really big part of my job and helping people use the data. And I do a lot of pricing and invoicing and that type of aspect. Thankfully, I don't have to deal with collecting any funds, but as far as like pricing that out, I'm the girl for that. So yeah, I'll say those are my main duties.
Now, what do you like the most about your job? And what's the one thing that you can do without if you had a choice to? That's what I'm saying. I don't like it.
Yes, yes. No, that's a good question. So I would say the my favorite thing about my job is being able to combine my interest and passion for the healthcare field and health, and combine that with tech, and to see how tech and data is so influential to health, which is something I really didn't understand before starting my master's of public health. Of course, I know like when I'm doing papers, I need data to prove my point. But now I'm being someone in this field, I really see that this is actually a building block of the health system. So actually having people who are skilled enough in this, so it's just as important as having doctors and medicine procurement. So there's different building blocks of the health system, and health IT is one of them. And I think just being a part of that and being able to influence health in that way is very nice. And I also really love being able to see all the different organizations and what they're doing. Since I work for a government contractor, I do have access to some information that I guess you could say is confidential, but it's nice to be able to see what all these organizations are studying, and just a lot of orgs that are really diving into finding different payment models to reduce the cost of care, and the different organizations looking into how to make healthcare equitable. And I just love being a part of that. One of my passions is health equity. So that it's really nice to see that there's so many places contributing to that. And I know from the outside, it seems like no one's doing anything. But trust me, guys, people are behind the scenes working really hard to make healthcare more equitable in the United States. And on to the part I don't like. So I never saw myself as someone who would be like super analytical, super into the nitty gritty Excel data entry aspect of it. So sometimes there are those days where you're just pushing numbers, you're doing your reports. It's not really me, but I feel like, okay, I can do it. And I know the importance of it. So I go for it. And I would say that's probably the on the bottom of the scale for me, just like that data entry and data entry, data entry.
So if I'm watching this interview and I was interested in the kind of role that you're doing right now, listing the good things and the bad things, what type of personality or characteristics, traits should you have if they wanted to pursue the role that you're currently in right now, or something similar?
Yeah, I would say you can be anyone from an introvert to an extrovert as long as you're able to have good communication skills and just communicate your findings effectively. But I don't think you specifically need to be an extrovert unless maybe your goal for like program manager type of role. Then, you really have to deal with people more often. So maybe you really do need to have those people skills. But I would say just having good communication, being able to write emails effectively, and being a team player, but also being someone that can work individually. Because I find that like the roles in the health IT space, they're very individual roles. Like no one's holding your hand through it. No one's micromanaging you, which I love. I love that aspect of it, but you have to be someone that's a self-starter. I would say that is a big part of it. Like you need to be able to take that initiative to maybe go into Outlook and try to answer a question before you ask your team, which is fine to ask for help. But being able to take that initiative, because we're all learning in this space of health IT. Health IT is a growing field, and I don't think the human brain is able to keep up with all the changes that are being made right now. So just having that curiosity and just ability to dive deeper into things, I think that is really going to take you a long way.
And I'm not sure if you've had a similar role where it wasn't government based, but whether you have or not, it doesn't really matter. The question really is, what is the main difference between working for a public
Mhm.
company or for a public entity
Mhm.
versus working for the government? What is the difference that could
Oh, okay.
maybe turn somebody away and say, you know what? I don't like that point she made. I don't think I actually would want to work for the government.
Oh, actually, what I was going to say, I think it would make them want to work for the government. But so
Okay.
I would say the main difference, and you can let me know if you think this is bad or good. I think the main difference for me is people expect you to be smart and they trust you to be smart. So it's a good thing and a bad thing in a way where it's like people aren't going to really micromanage you in this space. I find that people in the tech space in general are a lot more relaxed, and the
Yes.
culture is it's definitely a better fit for me in that sense. Whereas my experience previously was in a hospital in a nonprofit. So I feel like in those spaces, there's a lot of regulations. There's a lot of interactions with people where they're telling you what to do constantly. And there's maybe that micromanaging aspect of it. So I will say for the tech slash government contractor side of it, it's a lot more relaxed. And it's going to depend on the company. I guess I've just had a good experience with my company. So I can't speak for them all, but just based on, I have a lot of friends that are in this space as well, different companies, and they seem to think the same. You're going into a field where there's the expectation that you know what you're doing,
Yeah.
which can be a plus, it could be a minus.
Now, with that being said, I'm watching you now and I want to work for the government in a health IT position. How do I find these opportunities? How do I get my foot in the door? Because it's already competitive as it is just to find a job in general, let alone the government. So how do I get my foot in the door? What's your tips for them?
Yeah, that's a good question. So my tips would be to start with what are you most interested in the health IT space? Are you interested in the health data analytics? Are you more so interested in more so what I'm doing, where you're, I'm a program analyst, so I'm managing a program of data? Or are you interested in something else? So try to narrow that down. And then from there, I would say start looking into different government contractor companies. If you just like Google search like top government contractor companies, you're going to get a whole list of them. And you can even look up top health government contractors and companies like Humana, CVS, Optum, Raytheon. These are like those top up there ones.
Yeah.
But don't be afraid because for me, I work for a company that's going to be like up there on that list. But if I would have let that deter me, then I wouldn't be where I am today. From there, I will say specifically go to their career site. That I don't really use things like Indeed. Sometimes if I'm just looking around, like I'll use Indeed or something like that, but really going to their websites and typing in like keywords such as like health data, or maybe you can do like clinical documentation, or if you have a skill as far as SAS or SQL, typing those in and just seeing what pops up. Because I guarantee you there's going to be a lot. If you have a skill like that, you're good to go. So I would say the best bet in how I'm usually able to find jobs in this field is directly going to those companies that have those type of jobs. And maybe after this interview, I can provide you with some other companies that maybe, you can publish somehow. Because there's a lot that people may not necessarily know of. And also lots of universities will have health IT jobs.
Really?
Mhm. Yeah, because universities are doing research. Pretty much any like main institution in your state, they're going to be doing research on a variety of things. And they need people who are maybe on the clinical side, doing the clinical aspects of research. Then they need people who are doing the analytics side. And of course, people to manage the data and things like that. So there are I can guarantee you most top universities are doing research. that's a good
So
place to start. Well,
sorry, so how should someone's resume look? It sounds like to do a role similar to yours, they need to have some type of data analyst skill, whether it's SQL or being able, I don't know, use Tableau or analyze data or so they have to come into the door already having these skills. So someone that's entry level, meaning that they maybe just graduated from school, do you think they would be a good fit for these contract roles, or should they gain more experience first?
yeah, I think if you're someone like me and you have that public health degree background or something like a non-technical degree, I think the best bet is to start off and get some experience, get your foot in the door before trying to, because I think once you get into these like GovTech spaces, yeah, they want to see a little experience. And it's not necessarily that it has to be specifically technical, because like I said, I come from a community health background, which isn't super technical. And there were some technical aspects which we can talk about too. But getting your foot in the door and just getting that grassroots level, I think is very beneficial to not only just trying to get to that gov tech space, but also for you as a young professional and just trying to see what opportunities are available. I know sometimes we want to jump to making six figures, and I get it because when I graduated, I would love to have made six figures, but I think working at a nonprofit, I really feel like that built like character. I feel like it built professionalism in a setting where it was safe for me to make mistakes. Whereas now there's more the expectation that I know what I'm doing and I'm going to do it right. And back then there was just less at stake. So I think just building on that background. And if you are interested in the health tech space, like you can do a role where you're maybe doing some medical coding, or maybe you can try to get on projects at your job where they are doing some health data analytics and asking your manager, are there any opportunities for this to where I can expand on these interests?
And are these roles, are these, so these are contracts, right? These aren't permanent positions. Like you're working for a year or 2 years and then you're finding your next role. Is that how these positions work?
Oh, no. So I'm actually a full-time employee of a government contractor company. So they have lots and lots of contracts.
Okay.
So I just happen to be on like a Medicare contract. That's why I was saying before, I'm like a SME now on Medicare data. So no, it's a full-time position. I'm sure there are lots of positions where you are a contractor, but no, I'm a full-time employee of a contractor company. So like those companies that I was saying before, they're the same. Like they have a bunch of contracts and they partner with the government on a lot of the things. The government doesn't do their own work. They're getting other people to do it. And the reason for that is because they know these tech companies can get people who have the skills that they need to do this. And it shifts the work off of them onto these companies. So yes, there are plenty of opportunities for full-time work.
And does your resume have to be formatted in a different way? And I'm speaking from experience. I remember long time ago, straight out of school, wanting to apply for government positions. And I was pretty much told, hey, you need to set your resume up completely different when you're trying to apply for a government position versus just a regular public job. So I actually had to restart or organize everything before I was able to get my foot into NIH. I had to change everything. So is that the same for what you're doing?
Okay, yeah, I love that question because this is like the bread and butter of what I feel is gonna help you set you apart if you're trying to get into the health IT space, especially if you don't really have a lot of experience. So this is where you can really put everything out there to let yourself shine. So for if you're going for a government job and a job where you have to apply on like USA jobs, they do have a specific format that once you apply, you actually just now they have it in, and I haven't been on there in a couple months now, so it may be different, but they have it to where you just fill in all of their resume categories and it makes a resume for you. Now, when you're applying for a government contractor company type of job, I don't think there's a specific format to where you have to have it. I would probably just keep like a standard government type of resume style, since that's probably what they're like most familiar with. But I wouldn't say there's a specific format to how you have to do it. But I do think there are key things that you should have on your resume as far as having a professional objective or a summary, especially if you're someone that doesn't have a lot of experience. I think that really helps show a quick glimpse of what you've done before and how you're trying to transition, of course, your education. And I really like to emphasize this for new grads, like having some coursework on there that is relevant to what you're going for, because that's experience too. A lot of people downplay their education. And sometimes if you, let's say you have a public health degree, put that on your resume, maybe they don't really know how that's applicable to the field. So it's nice sometimes to add things like, I took a course in biostat, I took a course in data management, and then, of course, having some skills, that's great. And then your experience section. And then something that I keep on my resume is like my volunteer experience or just like some activities. So I think that kind of layout that's fine. Pretty standard.
Okay. And are there any resources out there for those that want to continue to pursue a government tech job? Maybe they watch this or have been thinking about it and they're like, you know what? Let me just go ahead and just start this process. Are there any things that they can do that you recommend to assist them as they're trying to move towards this goal?
Yeah, so let's break it down into a free resource and then like a paid resource. So something that they can do for free is they can start learning one of those programming languages that talked about before, a statistical software such as R, such as SAS, such as SATA. And you can learn that for free through resources like Codecademy, Coursera, and just start building on that foundation to which I feel like those are the top skills that will really help you go far in like health data analytics. Now, if you want to pay for something and invest in yourself, you can go to coding camp. And I think that would be a great way to really just become very strong in those skills. And I have friends who went to coding camp and they have just their bachelor's. They went to coding camp. Now they're in tech, killing it. So I would say I really want to emphasize learning these statistical softwares is going to put you ahead of the game because most people struggle with math. So if you can build your way up and start learning those skills that most people don't want to learn, that they shy away from, even in my MPH program, there are many people who shy away from those statistical softwares because it can be tough. Honestly, it is. It can be tough, but if you work at it, how are they going to deny you a job? They need someone that knows this stuff. So I think that would be like a great place to start.
And I was watching a video because I'm playing around with R just because I like to learn. So I've been playing around with R just a little bit. And came across a video where someone said that R is dead, saying that how no one really wants to use R anymore. It's not as relevant as the other coding languages. I was like, excuse me? So as someone that is working in where I'm sure R is very relevant, what are your thoughts on that comment?
Yeah, I would say that's not true at all. So something that I offer to my clients is a service where I'll find jobs for them and provide them with jobs that are relevant based on their skills. And when I'm looking for these jobs, a common qualification is knowing our studio. And even based on what my professors have told me in my biostats courses, R is the most sophisticated of the bunch. So I think that is more so what they're trying to move towards. Whereas with SAS and STATA, those are old school and most institutions are using those. And I've had people who leave comments like, SAS is dead, this is dead. But I can literally tell you, as someone that works in a government contractor position and can see who's using these tools, they are being used, and you 100% should learn one of them. There's no doubt about it. So R is not dead, SAS is not dead, STATA is not dead.
Thank you. I just wanted to get that on the record by an expert. Thank you.
Yeah, like, I can tell you for sure, like they are spending bank to use these. And the thing is, like people, it's not enough of us that are skilled to be able to even know how to use these tools. So they still are using old tools because you need to keep people who can at least use those. So I think there's plenty of room in this field for if you learn those skills.
Perfect. Okay, I will continue to play around with it just because I like to learn. Let
And
and and
I'm trying to. I'm trying to.
it's a lot, but I'm playing around. You did mention something that I cannot pass this. You mentioned that you have clients. What are you talking about, clients? What clients? What services are you currently offering at this time to people?
Sure. So, shameless plug, I do offer what I call career consultations in grad school consultations. So, as far as the career consultations, I've been offering a service, and this all stemmed from TikTok and people wanting me to help them. So, I developed this service where I'm providing resume assistance, helping improve the resume, and helping them tailor their resume, which is like a really big thing that we probably should talk about, tailoring the resume. Helping them tailor their resume for the type of job they want, getting the formatting right, as well as finding them positions with companies that I know are looking for people with their specific skill set. So it's a comprehensive service of resume help, job insights, and just general career goal navigation. So it's been very fun. I've been doing it since maybe November 2023, and it's been very successful so far. And I'm so grateful to be able to provide this service to people, and I try to keep the costs low, because I do want it to be a way that I can give back as opposed like, I do wanna make money, of course, but I want to provide something that people can afford if they're a new grad and they don't have a lot of money to spend, so I think it's been very beneficial, especially for those new grads who really are just lost from the sauce.
Yeah.
So, yeah, that's what I've been doing.
And do they have to wanna do like a GovTech position, or it can just be anything, just any health informatics position you're able to assist?
Yeah, anything like health related, I can help with that, being that I have such a diverse background. And of course, anything like health IT related, I can help. Anything tech related, I can help with that. So that's my general scope: health, public health, IT, and tech.
So, aside from this interview, I wanna follow you and learn more from you and more about who you are. Where can I find you? What are your platforms?
Yeah, so right now I'm on TikTok as the Bragg and Dragon, and on YouTube I'm also okay. So TikTok is Bragg and Dragon, and YouTube is the Bragg and Dragon. Just a little play on words. My last name is Bragg, so sometimes people wonder why that's my handle, but I'm not
That was
Bragg.
my next question, by the way. I was like, where did the dragon come from? That was my next question.
Romans or Men's Nicki song. I got that
Okay.
thing dragon. So this all happened like when I was probably like sophomore year in high school. So that's when I became the Bragg and Dragon back in high school. And it just stuck with me. And I like the idea of the dragon. I feel like they're powerful and they go for what they want. And I feel like that's something that I want to embody and I want to help other people embody. So my consultation services, they're called Rising Dragons. And that's because, yeah, my first name, it actually means she who ascends. So that's where the rising came from. So just helping people rise and ascend to what they want to do, which I feel like that's my expertise, helping people identify their goals and speaking that life into them and helping them get where they to be.
I love that. Okay.
Thank
So, as you're helping people rise and discover themselves and helping them out, let's talk about you. Where do you see yourself? Or where would you like to see yourself, or you think you want to see yourself in the next 10 years? And I always ask this question so that 10 years from now, you can look back and say, I did it, or okay, life.
Yeah, that's such an interesting question as we talked about earlier, because had you asked me 10 years ago when I was 18 years old what I would be doing now, I definitely would not have said health IT. I would have said I would have been a doctor, I would have been an OBGYN. So it's so tough to answer a question like that with so many interests that I have. But let's say I stick around with the health informatics and the health IT, I see myself moving up and being someone that has a variety of ventures. I could see myself maybe part-time in academia. I could see myself running my own health promotion program and using my skills in health analytics to help amplify that program and making sure it's reaching the target audience. I could see myself going on to doing a clinical role and maybe pursuing my interests that I've always had in being a physician, but also someone that is a bit of an entertainer. I could see myself being an actress, being or a motivational speaker. I think the motivational speaker that for sure will be maybe within the next couple years. Just as whatever I'm going to be doing, I always want to make sure I'm amplifying the voices of the marginalized people. I'm always uplifting those people. And something that's really important for me on my channel as a Black woman, as a queer woman, is to create a safe space for people like me to be able to find a way into certain fields and be able to find places that are safe for them to be in and finding community. So wherever I am, I just want that for me, my presence to be a safe space and a place for just equality, equity. So we'll see where the career goes, but the sky's the limit. And where I'm at now, I feel confident that I'll be able to reach any goal that I want. So I'm excited.
And I do want to tie in here in terms of reaching your goals, a question that I don't want to miss. And in your opinion, getting to this point that you are right now, what role do you think that networking played to get you to this point, just to help those that may be trying so hard and they're just hitting a wall? Like, what or how can networking help, if any?
Yeah, I think networking can be crucial. So for me, when I was interested in getting into the health IT space, I started reaching out to my friends that were already in that. They weren't necessarily in health IT, but they were in tech. And reaching out and asking like, what should I put on my resume? Where should I look? And can you give me a referral? Those referrals come in handy. I won't necessarily say that you need to network, but develop connections with people where it doesn't have to just be this networking thing. Just develop real relationships with people and people that you trust that can help you and refer you and just give you some guidance. Because without them, I wouldn't have even maybe had the confidence to shoot my shot. They told me, like, they gave me some tips, and I'm saying, wow, let me give this a try. And I really think it's valuable to have people on the inside that can give you tips, specifically like what you should be highlighting on your resume. So I think networking is very valuable.
The resume. We know that the resume is so important. So, how should I tailor my resume for these roles?
Yes. And this is something that is super crucial. So I really wanted to talk about it today. So when you're working on your resume, you have to understand that a human is not going to read your resume first. A computer is going to read it, an applicant tracking system. So you have to trigger the applicant tracking system. A problem that I see often across all levels, whether entry level, master's level, experience level, people are making general resumes, which isn't necessarily bad, but it's not good either. And it's not necessarily going to get you what you want. So you really need to tailor your resume and use words and phrases. And I'm saying it like this because I want you to understand. Please do. Okay. Words and phrases from the job description and put them into your resume. So an example I like to give people all the time is, let's say a job description says they want someone with experience doing clinical documentation and inputting patient information. I want you to say that specifically on your resume, of course, if you have that experience, and word it just like that, just so you can trigger their applicant track. And at the bottom of job descriptions, usually they just have a list of qualifications. Go down that list and add those qualifications to your resume if you have it, of course, to specifically trigger their applicant tracking system. Because after you do that, then maybe somebody will read it. That's what we want. We want the hiring manager. And of course, sometimes recruiters will read it before a hiring manager, and they may not necessarily be a technical person. They may not know well, all of this SQL and this and that is, but they'll just see that, oh, they have that. Job description says that. We're going to pass it on to the hiring manager. So it's a very simple thing, but I just want to emphasize it because a lot of people don't do this.
Perfect. You guys got that? Okay.
Listen
And you guys can see why she's on the channel, because she has a wealth of knowledge to share. So I know that someone has taken something away from this conversation. Where can my audience find you after this? Go ahead. I know you plugged it already, but just for those that may have missed it, where can they find you and what are your future plans as well? I want to make sure that you have a chance to talk about any future plans that you have for yourself.
Yeah, so they can find me on TikTok, Bragg and Dragon, or YouTube, Bragg and Dragon. Some plans that I have coming up that you guys may be interested in. I'll be dropping a free resource guide for becoming a health informatics analyst very soon. It's in the works, so just stay tuned on that. I will be publishing my website soon, which will have a variety of interesting things on there. I'll have, of course, the plug to my career consultation scheduling. I'm also going to be putting some of my workings as a MPH student on there. So if you're interested to see what an MPH student does, what we write about, I will be posting some of my assignments that, of course, I got good grades on. I don't want to show you guys stuff with bad grades. And just talking about like relevant topics, blog posts type of thing. So it'll be more of like a blog and just a catch-all resource for health informatics and also just having things about me. So if you're interested in just knowing more about me, that will be there. And on TikTok, it's a shame that TikTok will be banned soon. I find that TikTok is one of those spaces where I can actually be myself. But yeah, on TikTok, while it's still up and running, I'll definitely continue to post daily tips. Post about public health careers, health IT careers, just a lot of tips. And I also balance that with my lifestyle content, just being a young woman in my 20s. I think it's really important for people to see people like me that are able to still live their life and balance that professional working woman careers. And it's also pretty entertaining, in my opinion. So that's what's coming up soon.
That's a lot, and that's great. I want to first of all, thank you for your contributions to Health IT, for sharing. For those that are watching, I did find her just randomly on TikTok, and she has a lot of great information, a lot of a great following. Just she's helping a lot of people. So I just wanted to give you her flowers on camera. She does not know I was going to do this. But I want to just thank you for your contributions to Health IT. We need more people talking about it, sharing, giving out information, and you're doing that. I really appreciate that. So for those that are watching, please share, follow, support what she's doing. She's really helping Health IT, and we need to get Health IT going because we all are going to be impacted by it as patients, our families. We all need Health IT. Please support and share as much as you can. Before I close, any final words that you want to tell the audience? I guess like your final piece of advice for that person that is, I want to be her and I want to do what she's doing and I don't know what to do. What's that last piece of advice for them?
Yeah, definitely. I was just talking to my girlfriend the other day, and she asked me, we were playing one of those little card games where you ask questions. And one of the questions was something like, what do you like about yourself? And I explained how one thing about me is that despite it all, every day I'm going to put one foot in front of the other, whether I got knocked down the day before, whether I got knocked down that day. I'm going to continue to be a force in my life because no one else is going to do it for me. So I encourage anyone that may feel like they hit a wall or they feel like they don't know what's next is just take one step every day. You know how I told you guys I'm working on my website and all these things. Just every day I contribute a little bit. Just keep going every single day and never give up on your dreams. I know it's so cliche, but you can't do that because I'm telling you, no one's gonna do it for you. Okay? Unfortunately, unless you marry rich, but maybe you should be the rich spouse. I don't know. So just always keep your desires at the forefront of your life because this is your life. There's so many times in life where there's so many things going on. We have to put other people's needs before our own, but you are the controller of your life and go at that with a passion. Go at that with the drive where you know that this is life or death in a sense where if I don't achieve what I want to achieve, whether that is a tangible goal or an internal goal, just keep going for that. And I promise you, like, you will make some progress if you keep going day by day.
Gonna end it there. Well, thanks. That was good. This was great. Thank you so much for your time. I hope you guys took something away. You have learned more about what a health informatics analyst does in the gov tech space within her realm, how to get into government tech roles as a contractor. There's so many things that we've learned. I can't even summarize all of it, but thank you guys for watching. Please follow her. I'm going to put all of her information for you in the description of the YouTube video so that you guys can, of course, connect with her. And thank you once again for your time, Dragon Horizon. Thank you. Horizon Dragon. And I thank you for your time today. And I will see you guys once again somewhere. I know I'm everywhere, somewhere on YouTube. So thank you guys and have a great day. Bye.
Bye. Thank you.